The recent outbreak of coronavirus is one such example where our Filipino nurses around the world are called upon to respond immediately to the call for help in this pandemic. Thus, on the 12th of March 2020, the FiND network directors developed and shared its position statement to help Filipino nurses worldwide during this pandemic. The position statement called for two main important actions, and these are: first, encourage our Filipino nurses to be continuously informed of the disease and to work closely with other healthcare professionals to establish and maintain a comprehensive and collaborative plan of action, and to encourage our various Filipino nursing organizations across countries actively participate in planning strategies together with other healthcare agencies and assist in the implementation of programs. To meet one of the strategic plan of the FiND network, the group on the 28th of March 2020 decided to conduct a global survey of Filipino nurses. The rationale for conducting this global survey of Filipino nurses were as follows. First, the recent outbreak of coronavirus has impacted everyone, but also puts the Filipino nurses in a crucial spotlight. Second, such survey would assist in better understanding current Filipino nursing value in diaspora and identify perceived confidence, particularly on COVID-19 related issues. Furthermore, this survey would identify emerging trends and development opportunities. And most importantly, while there are country studies that looked into Filipino nurses, there is a paucity of data that investigate them from a global perspective, regardless of intended issues. The research design used was a convenience online survey of Filipino nurses with the assistance of principal leads from 12 target countries. We developed a short survey to answer our research questions, including country where they work, 5 Likert scale items asking them how worried they are about the impact of COVID-19, how easy or difficult it is to work effectively during the COVID-19 pandemic, how confident are they in the country's government to make the right decisions to manage the pandemic, how confident they are in how to manage resources and benefits from their employers to support them during this crisis, and outside of work, how confident they are that they have the right support network to help them during this period of crisis. The survey also included 3 open-ended questions, asking them to list the 3 top challenges that they have during this crisis. What are the greatest work-related concerns they experience, and what are their ideas how Filipino nurses should be supported during this crisis? The results of this survey came from 401 nurses globally. It involves nurses coming from 12 target countries. They are from USA, UK, UAE, Singapore, Saudi Arabia, Qatar, Oman, Kuwait, New Zealand, Ireland, Canada, and Australia. The other countries where nurses participated came from Germany, Norway, Taiwan, Nauru, and Italy. The results of the survey were as follows. 74% of nurses were worried of the impact of COVID-19. Given more recent announcements and guidelines that suggest staying out of public spaces and keeping gatherings under 10 people, This number may likely rise in the days to come. 60% of the nurses were experiencing difficulty working during this pandemic. Many nurses are dangerously ill-equipped to care for COVID-19 patients due to limited access to supplies such as gloves, goggles, face shields, medical masks, respirators, gowns, and aprons. Only half of the nurses were confident in their country's decision to fight against COVID-19. For example, in Australia, they announced substantial funding to train 20 nurses in critical care. Less than half of the nurses were confident on the resources and benefits the company provided to them during the COVID-19 crisis. In many countries, the healthcare system remains underfunded, understaffed, and under-equipped. Only 38% of the nurses were confident on the right support network they received. The chaos of coronavirus underscores the challenge that nurses face in reprioritizing their own wellness in the face of limited resources, often brutal hours, and seemingly endless demands for their work. The three main top challenges during this crisis that they reported were social isolation, communication with coworkers, and their physical space. The greatest work-related concerns that emerged from this survey were four themes, with an overall main focus on safety, which are all interrelated. Being exposed to managing patients with COVID-19 requires special protective equipment for the nurses and all healthcare professionals, for without this to protect them, they could be exposed to the virus, thus rendering them inactive to continue to work and leading this already to the shortage of nurses. Lack of qualified staff were reported as a major concern, especially when working in intensive care units. The nurses then reported that they had to do more shift work and they get tired. The organization should provide accommodation and food for them to rest at work so that they do not have to go back and forth from home to work. Lack of staff can be overcome by deploying nurses from other wards, but they will need preparation. Nurses reported that some of them are being deployed in clinical areas where they are unfamiliar and without proper orientation on how to manage the infected patients, as well as how they could protect themselves. It was suggested continuing education utilizing telehealth for teaching and learning can be effective so that communication updates can be transmitted to them as soon as possible. Without preparation, they reported that they will feel incompetent to care for the patients, as well as how to protect themselves from being infected, and as well as how they can protect their own family when they return home from work. Another theme that emerged was the lack of recognition of their work during the pandemic. The nurses reported that the organization where they worked should recognize that nurses needed not only the physical support to protect themselves from being infected, but also the psychological and spiritual support. They felt feelings of uncertainties as to when this pandemic will be over. Some felt hopelessness that they will not be resilient to overcome the challenges they face, especially seeing a lot of their patients die because of this virus. Because of the high risk for infection, nurses reported that organizations should be able to recognize their worth by receiving financial benefits, such as hazard pay. Three teams that emerged suggesting their ideas how Filipino nurses should be supported addressed the concerns as reported in the last slide. Continuing education is important for them to have update information about the management of the virus. This is particularly important for those nurses being deployed to other clinical areas to the COVID-19 specific areas. Also important for retired nurses being called upon to overcome the staff shortages, as they need more than ever refresher courses and upskilling. The physical, social, and spiritual supports are needed to prevent burnout as a result of experiencing fatigue and feelings of depression and hopelessness. Even though Filipino nurses reported that they are committed to give 100% of their time selflessly to care for the infected patients, they also need the organization to support them during this pandemic. Material and financial benefits are ways that organizations can recognize their work. Some suggested being provided by accommodation and food at work to overcome their tiredness during and after the shift work. From the results of this survey, we have the following recommendations. Approach employee assistance program to allow space for discussion on any workplace matters in confidence. Approach respective nursing unions and or national nursing associations, including Filipino nursing organizations, to come up with programs and services that address the needs of nurses, particularly on the personal protective equipment provisions. Explore pastoral care support offered by employers and other organizations. Enhance collaboration with other Filipino nursing organizations and appropriate entities to advance relevant and timely needs for Filipino nurses, and conduct continuing, relevant, and timely researches that would address the needs of Filipino nurses. From the recommendations as a result of the global survey of Filipino nurses, on the 15th of April 2020, the FiND network developed the COVID-19 Action Plan. The development of the COVID-19 Action Plan was because the FiND network recognizes the need to meaningfully respond to the health and welfare of its nursing constituents and to conscientiously and consistently address its pivotal role and desire to collectively engage nursing organizations and individual nurses. Over the coming days and months, the development and implementation of the FiND network's activities will be responsibly shaped by the projects and programs from reputable healthcare organizations and authorities. Its strategic directions and insights are based on the results of the recent global survey of nurses. From the COVID action that we have developed, we then identified what are the responsive actions that FiND network should be able to do. These are to identify respectable spokespersons and country-level contacts, develop key information and infographics, and re-emphasize suspension of face-to-face meeting. To move forward, the FiND network has to continue to participate in monitoring and in mitigating risk of spreading the pandemic actively and coordinate with partners while continuing to retain the flexibility to respond as conditions evolve. So thank you all for your attention. Let us work together to continue to support Filipino nurses in the diaspora.